So what I'd like to do is introduce everybody to Captain Theo Gonzalez of the Thornton Fire Department, who is here because he and his colleagues at the fire department have been heroes for Thornton and really for the metropolitan area. And so, Captain, why don't you introduce yourself? Tell us a little bit about yourself, and then I'll ask you some questions about how you all really decided to get involved with caring for the community as we entered this pandemic.
Yeah, absolutely. And again, I would like to thank you just for all of your support, and thanks for having me. I'm Captain Theo Gonzalez with the Thornton Fire Department. I've been with the fire department for almost 18 years now. I've been a captain for almost 2 years, and before that, I was an EMS lieutenant for about 3 years. So I've been on the other side of the ball, so to speak, not the exciting part where you run on a fire truck and jump off and put up fires. I now put out more of administrative fires, so to speak, is what I deal with these days. And so yeah, I'm really excited to be here. Thank you so much for having us, and again for your support.
Well, let's go back now a year and a half. You said you were EMS specialist for 3 years before becoming captain at the fire department. So as an emergency medical specialist, I guess, what were some of your responsibilities? And then how did that get you involved as COVID started to find its way to America and to Colorado?
Yeah, so that's actually a kind of an interesting story. In my prior role, I was actually the name of my role was a SAM lieutenant, which stands for Safety and Medical Officer. And so in that role, I worked on shift. I drove around in a little Tahoe, and I was kind of the supervisor for all of the paramedics. I'm also a paramedic. And so, yep, medical stuff is definitely my specialty. Well, on the side, kind of my side gig at Thornton Fire, so to speak, is I am also the designated infectious control officer for the entire city. So anytime there's a small outbreak of flu, or somebody, on an ambulance accidentally sticks themselves with a needle that, has some blood on it from somebody else, or something like that. Anytime there's an infectious control problem, myself as the infectious control officer, I usually respond out and I mitigate those things through various mechanisms. And so, this little blip came out on the radar, 2 years ago now, of, hey, what's this COVID? It wasn't even called COVID-19 at the time. I can't remember what they were calling it. But we knew there was a coronavirus or some sort of pneumonia spreading, in the Wuhan province out there in China. And our SLT, who is our senior leadership team, and that's comprised of, all of the leads for the city of Thornton, the city manager, and all of the higher up types, they wanted a briefing on, well, hey, what's going on over there? Is this something we've got to worry about? And so the fire chief asked me if I could put something together, and myself and the EMS chief, we did our homework, we dug in and we did a lot of research, and we presented to them, hey, here's this thing that's causing these pneumonias over there. And at the time, we didn't think it was going to end up here. We kind of just told our city leadership of, hey, this looks like it's going to be an isolated thing. There's this wonderful organization called the WHO, the World Health Organization, that has all these protocols that protect us, and they're doing their job, and we think it's going to be fine. But here's the information, and here's what we're going to do if it's not. And so, our chief, who was very progressive, Chief Gordon Olson, he had already had a pandemic plan that was kind of, just this generalized framework for us to operate in any pandemic. It could have been a flu, it could have been whatever the world wanted to throw at us. And we went through the framework, really the skeleton, the bare bones of what that plan was going to look like with the city. And I remember very distinctly at the end of that, they're like, oh, well, good, that's a great plan. We're not going to need it. Thanks, guys. And we walked out the door, and, here we are some 2 years later. And I think back to that meeting and I think about, wow, boy, did we underestimate that one.
No kidding. So tell us what some of the steps were that you took after that. I mean, obviously you guys had been prepared, but still weren't expecting, the virus. And I think we were calling it the coronavirus, back then. What did you do as it started to expand, grow? What steps did you then take?
Yeah, so very quickly, obviously, back that was in January, February. Obviously, by March, we had some good reports that it was starting to spread across the world, and there, in fact, was one case. I believe it was in Washington, and since it had showed up on our, in America, that was when we really stood up and said, "Wow, we need to take this thing serious." And so our operations chief and our fire chief, Chief Hobbs and Chief Gordon Olson, they actually pulled me out of my role just because I had been working on some of this research and just kind of doing my homework. So I was kind of the only one, not that I knew any bit more than anybody else. I just knew a teeny bit more. And so they pulled me out of my role and they brought me up to the office and took me off of my 48-96 schedule. I used to work 2 days on and work 4 days off, just like the rest of the fire department world. They brought me up, stuck me in an office and said, "Your job is to learn everything there is to know about this and prepare us and coordinate all of our responses." And so that's what I did. I just had a really good jump start because of my background as an infectious control officer. And so that kind of shortened my learning curve a little bit. I was able to kind of know exactly where I needed to go and what I needed to know to kind of build onto this framework that Chief Olson had given us. And away we went. I started working basically 40 to 60 hours at that time, just basically all on COVID.
So, I mean, I think you guys were obviously pretty farsighted in this, that you really, one, you had prepared, and two, you had the background, but you said, okay, this doesn't look very good. Let's really understand this and then take steps to protect the community. So, I mean, it's a heck of a team effort that you've got going from the top all the way down. So tell us, your department ended up winning the #1 fire department for dealing with medical kinds of things in America. So tell us some of the things that you and your team did to win that award and to protect Thornton and sort of North Metro area.
Yeah, so out of all of those things I kind of just described, spawned these programs that, the best way we figured to fight the pandemic was really at this local and regional level, was to kind of do our part, so to speak, was to kind of, carry our own water up the mountain. And so we really looked at what could we do within the department to protect our people. One of the big problems we were worried about right away, and it ended up being pretty on spot with our forecast, was we were going to have people get sick and within our own fire department. And that was going to really hamper our response to go take care of citizens, because that's our mission at the end of the day, is to take care of the people that we serve. And so right away, we knew that, we were going to be dealing with a workforce problem, that we were going to be having people sick and we might have to close down fire stations. And then that would really hamper our ability to go out and run calls and take care of people. Right. And so one of the things that we did right away was we put in a very aggressive infectious control program with contact tracing. We were doing things in the fire department that, public health agencies typically do for us, but they were so overwhelmed that they just couldn't reach out and help some of us, because they were out contact tracing the thousands and thousands of COVID cases out in the community. And so we really brought a lot of those things in house. And one of those things, and one of the reasons we did get our national award, which we're so grateful for, is we started a monitoring program for anybody that worked. It started in the fire department, and then we actually branched it out to anybody that was a City of Thornton employee. Is we started a monitoring program. So very early we got into testing, and so testing was part of our surveillance program, because we knew we were going to have to find people that were positive, then we were going to have to take care of them. And then we knew eventually down the road we were going to get a vaccine, and we wanted to get those into arms as soon as possible as well. And so that was kind of our plan, was we want to take care of our employees, we want to take care of our community, and out of that spawned our monitoring program. So right away we got into testing, and we worked with Colorado Department of Public Health and the state lab, and they gave us the ability to use their lab, and we basically collected samples, and we stood up a mobile testing site, which was one of the only testing sites for a very long time up here on the north end of town in the metro area. And so that gave us the ability to do testing in our own fire department, which was really big because we knew we wanted to take care of our workforce. And so right away.
Let me stop you there. So you were working with the state health department and you were creating, in effect, your own lab for all of this. Is that what you're saying?
Well, so what ended up happening with that was because we were using the state lab, there were these long turnaround times, and that's through no fault of their own. They were just getting overwhelmed with all of these specimens from all over Colorado. There just wasn't a whole lot of labs that could handle that kind of volume. And so we would collect specimens and send them down to the Colorado Department of Health state lab. And they, at first they would take about 48 to 72 hours, 2 or 3 days to get back to us. And then we got to the point where there was so much volume, and it wasn't just from us, it was from all around the state, that those turnaround times for those tests were 7, 8, sometimes 9 days. And so we all know that you have a 10-day isolation period when you get COVID. And so some people would get COVID and be done with their isolation, and then they'd get their tests back. Then it would say, hey, you thought right, you were positive. And so we thought about, there's got to be a better way. Is there any way that we could have our own lab? And we kind of said it in a meeting in jest to the fire chief. The fire chief, I still remember it like it was yesterday. It was on a Zoom call, just like we are on today. And he was like, well, we've got to do something about these test turnaround times. And I said, well, that's going to be kind of hard, chief, because it's the state lab. I don't think they're going to listen to little Thornton, like, hey, turn our tests around. I go, but we could get our own lab and do it in house. And I said it in jest. And, the fire chief looked at me and he said, well, can we do that? And I said, let me look into that. And when we ended up finding out we could do that, and we did.
Nice. Well, and how many other fire departments stood up their own laboratory to be able to handle this pandemic?
0 that I know about. And I think that's what definitely helped us win our congressional award, was just that outside of the box thinking. And really just that little piece of the pie, so to speak, on getting that testing and laboratory capability within our own fire department. It allows us, even today, we're running testing out of our Fire Station 5 for City of Thornton employees. We can have a test result in 15 minutes. And some of those people are at work. We have police officers that come in and, everyone's got the sniffles, it's that time of the year. Very quickly, we can know in 15 minutes if you're positive. We can pull you off the streets, send you home, and isolate you. And then we can also give you a piece of that monitoring equipment that I was starting to talk about earlier. The Massimo safety net is basically a small bracelet with a hospital-grade pulse oximetry unit that attaches to your finger. And it communicates via your cell phone, and it sends that information to your cell phone, and it also sends it back to me in a central dashboard, and it allows me to monitor people from their own home. So basically, I get email alerts if somebody's oxygen saturations drop, below 90, which is worrisome because that's how we find a lot of our early pneumonias with COVID-19.
So how many, and just if you've tuned into our little local heroes as we've been going through this, I'm talking to Captain Theo Gonzalez, who he and his department are part of our local heroes program. So Captain, tell us, you talked about the vaccines, you talked about testing. How many tests, how many vaccines, how many tests have you taken? How many vaccines have you put in somebody's arm?
Yeah, so testing, we've done over 30,000 COVID-19 tests. We did a little bit better on vaccines because we really were aggressive with that. And I think I checked with our team Friday just to get a more accurate count, and we're sitting at just above 92,000 vaccinations. So, we're nearing towards what the population of our city in Thornton is, which I believe it's now the 4th or 5th most populous city in Colorado. And so that's kind of been our goal, was can we get one shot into every arm and hit that magic population number. So we're still going strong. We still run 4 clinics every week. And we're also doing one day strictly for kids, 5 to 11. So we have a special vaccination day for the kiddos. We have a characterization team, which was formerly known as our clown team, because they dress up like clowns. And they usually do fire safety presentations for schools, but we had them come in, and they've been a really great distraction for some of our littler kiddos that are very afraid of shots. And so it's a little bit nicer when you get a shot and you're being distracted from a character like a clown, or we have Buzz Lightyear, we have Spider-Man, things like that. And so that's been really effective.
Nice. Well, I was just on an interview with Yahoo Finance, and they wanted to talk about this new variant, the Omicron variant that was first noticed in South Africa, but seems to be popping up in other places. And they're not too sure exactly how transmissible this thing is, how dangerous it is, but we're not out of the woods with this virus. So are you guys keeping the program intact, the team intact? How are you looking forward in terms of using what you've learned?
Yeah, so with the support of the city manager, our city council, and our fire chief, really they've been forecasting that, hey, we're not going to shut this thing down till basically Fauci comes out and says, hey, it's over. Then we're going to turn the light switch off. And so we're following Omicron very, very closely. Now, obviously, we've seen variants come and we've seen variants go, and some of them take off like Delta did. And then some of them just kind of fade off like Lambda. And then, Gamma was another one that we were kind of watching out for. So Omicron, will definitely, there's a learning curve that happens with all of these variants. And so we're listening very intently with open ears to hear, is it going to evade vaccines? Is it more contagious? Will it outcompete Delta? If those things happen, then, what we'll do is we'll make sure that we still have the testing capability. Can we still capture and find those people based on our RT-PCR laboratory testing that we do now? And then second, one of the really cool things about the mRNA vaccines, versus like the old school technology that we use for flu vaccines, is they can, if Omicron turns out to be sort of this nightmare variant, all they got to do is cook together a new recipe that's tailored specifically for Omicron and mass produce it, and then they'll get it out to us and we'll put it in arms. And so that can all happen pretty quickly, within 2 to 3 months. Whereas, old school flu vaccine, if you missed on it, better luck next year. So we're really, globally, we're in such a much better place than we ever were, even at the beginning of the pandemic, just because we have access to that technology. And so Thornton Fire stands ready. We're ready to do whatever it takes to help put this thing to bed. So, if that means a new booster shot that's tailored specifically to Omicron, or whatever comes next in the Greek alphabet that I probably won't be able to pronounce, but we're willing to put more shots in arms and do what we can to help our community.
Well, I just want to thank you, Captain Gonzalez, one, for your service to our community. And I want you to please extend our thanks to all the members of the fire department and to the city for being so forward thinking on the community and the health of the community. This has been a wonderful interview. You clearly are one of our local heroes, and just want to thank you for what you're doing and what you will continue to do. So any parting shots from you? And otherwise, I think folks are really going to enjoy this interview.
Yeah, we're so excited, that you came out and saw us, and that we're happy to be involved here. And thank you so much for thinking of us with Hometown Heroes. It definitely takes a village. And so again, we could not do this without your support. Really support all the way at the highest highs, of government, because really for us to do what we've done, it's taken, some CARES funding. It's taken some things that you guys have done at your level to make it down to us to make a difference. And so again, we could not do it without you. And thank you so much. I know you're working pretty hard right now, and I'm sure you're going to be working even harder as this month goes on with Omicron and stuff. And we're really excited. We're going to keep doing what we're doing. We're rolling out a new monoclonal program. We're going to be giving monoclonal antibodies. We'll be one of the only fire departments in Colorado that are doing that, just as another little piece to this pie. And we're happy to keep doing it. Thanks so much for having me. And